Hey everyone, this is Dr. Charlie Johnson, physical therapist. Appreciate you checking out this video and this channel. Really excited to be here today with a gentleman named Jim. He lives in Ohio, I believe. I thought Iowa, but that's because I think of the big bucks, and well, there's big bucks in both Ohio and Iowa, and they sound kind of similar. So either way, I'm here with Jim. A long history of dealing with some different types of pain issues, right? Kind of the SI joint and some other areas. And he just totally crushed it as a member inside our Glute Relief Accelerator program, even though I think in the beginning he was a little bit skeptical that we could do anything given everything he's tried. And so, Jim, I just appreciate you being here, man, to share your story. It's been, I'm just so grateful to have worked with you and come across, you and have you inside the program. Just such an asset to the program, and not only just for yourself, but then also kind of leaning in and helping other people as well. So, great to have you here.
Well, glad to be here, Charlie.
Yep. Yeah, man. So if you can, right, just share for anybody who's listening, right, and is maybe watching this and probably has some type of SI joint pain or pain in the butt or pain in the leg or something like that. Can you sort of paint a picture for what life was like, what you were dealing with, what you were told was wrong with you right before joining the program and getting things started?
Yes, it's a painful memory, but fortunately, it's receding into the rearview mirror.
Yeah.
Yeah, it's sort of a 2-year ordeal.
Mm-hmm.
I hurt my back, and kind of went through our siloed medical system to no avail. I started with my internist, had some steroids, then I went to a orthopedic specialist, prescribed physical therapy. Tried that on and off, got kicked out of physical therapy because I wasn't improving at all. Then went up to Cleveland Clinic, was evaluated up there. They did a few joint, or rather, I had an orthopedic surgeon, not an orthopedic, but a osteopathic physician who did some manipulation. And then I went back to physical therapy at OSU. On and on and on and on. And I had gotten by this time last year, I'd gotten kind of back maybe 75%.
Yep.
But month after month, I couldn't get that last 25% or 20% to the goal line. And my pattern was that I do my PT exercises, this would flare up, that'd flare up. Then, that, but I would have good days. But every fourth day or so, I'd have a really distracting pain for 3 or 4 hours. And so I sort of concluded I'm either done or I'm going to try one more thing. And I got on the glute accelerator thing and started looking into it and checking out the reviews online. And I thought, well, what the hell, I'll try it. And then I resolved that, this is it.
Yeah.
If this doesn't work, I'm going to stop the endless search for the practitioner with the silver bullet. But it was a totally different approach. And I liked the idea that it was grounded in science. I liked the idea that it geniusly kind of merged the science of movement medicine with the evolving science in
the mind.
Your neurons are sending false signals to your brain based on habit. And certainly as an obsessive person, I was a leading candidate for that type of pain. It's you're focusing on the brain and you're thinking about, oh, does it hurt, or where's it hurt, or oh my gosh, it hurts, or maybe it does. Oh, it does. Oh, now it does. So, and dived into the program, and just took it day by day and step by step, and everything was so well organized and a logical, progression of lessons and things to achieve. And, it takes time. But anything worthwhile does. And I spend a couple hours a day every morning first thing, all right, this is what I'm going to do. All right, check this lesson off, move to the next. And it was illuminating and liberating, and started trying some of the things. And and there are different techniques that work or not work depending on your individual situation. The protocol is sufficiently flexible that it can accommodate about any variable that you may have,
Yep.
with respect to your pain. And eventually it just after basically getting to stage 4, I was pretty well good.
Yep. Yeah, and where are you now, man, if I can ask, right? How are things now? So
I've resumed all normal activities. I mean, I do have I try to walk about 1.5 or 2 miles every day, and occasionally I do have a little bit of a tight or pain in my right SI joint area, but it goes away. I'll take a Tylenol or so, but just now this week I don't think I've had anything this week at all.
Yep.
So, but I'm not but the big thing is I'm not thinking, well, can I do this or not?
Yeah.
I just do it. If it's something I want to do as part of my normal activities, I just do it.
Yep. Yeah. So you're back to, I think, doing some biking, right? I know you had held on a fishing trip for years, right? Because like, hey, how am I going to be able to do that? Sit, function, fish, have fun all at the same time. And you were able to do that this not too long ago, correct?
Yeah. In September,
Cool.
Some college friends, we go every year, and I'd missed the last 2 years.
Yep.
So I went this September, and I had a few bad moments, but it was manageable. And,
awesome.
And now I'd be more confident about going.
Yep. Yep. Yeah. So you're well on your way out, man. And so let me ask you this, right? So you came into the program, right, where you were, not a square one, right? Not no improvement, but you got to 75-ish%. By the way, I would ask this: what do you feel got you to 75%? So you went to the Cleveland Clinic, a lot of smart people there. You went to OSU, Ohio State University. I applied there, by the way, and didn't get accepted. Okay, so we'll take that. And so what do you feel got you to the 75%?
I think it was exercises, I believe, and just being determined to get off my back and actually do something. I was on my back the first winter for probably 20 out of 24 hours a day.
Yep.
Because you get the medical system puts you in this mindset that unless and until you can figure out what the cause is, don't do anything.
Yep. Yep.
And that was actually, in retrospect, probably the worst thing I could have done. And it certainly delayed my, healing.
Mm-hmm.
But frankly, it was just getting off the couch and, starting to do some stuff, even though I was having, discomfort a lot, was probably the start of the process to get back. And, it's just amazing to me that nobody in the medical system bothered to ask or tell me to do that.
Yep.
I mean, they're so focused on, all right, what's the cause here? And then let's figure that out, and then we'll kind of go from there. Well, there's no collaboration among specialties. So you go to one person, they say, well, let's try this. Oh, well, that didn't work. Well, you need to go to this person and see what they say in this specialty. I had 2 neurosurgeons tell me to put pins in my right ilium to freeze it. And really? And it's just like, I'm not going to do that. You can't tell me A, 100% is going to work. And B, the joke with my friend, a lot of my friends are physicians. The joke is that the surgeons, they'll tell you, they'll urge you to do something, and then which involves some intervention by them. And then when it doesn't work, they'll look at the x-ray and say, well, the x-ray looks fine, so, you must be okay. Well, no, I'm not,
Yeah.
I digress. So
Totally, man. Okay, but it's safe to say, right, that you didn't have like a really good process for understanding how to get better. Is that accurate?
That's key, and that's the distinguishing characteristic of your program is that it has a process that includes every conceivable variable,
Mhm.
and it puts the onus on you, the patient, to go through the process and heal yourself.
Yep, yep.
And given the limitations of the medical system, that's really makes the only thing that makes sense in my opinion.
Yeah, yeah, awesome, man. And so like when you went to PT, right? What did that look like? Did they give you a sheet of exercises? Was it, hey, no, we're gonna systematically test this thing? Like what did it look like?
Well, the first couple times it was sort of the cookie cutter PT, which basically is core strengthening.
Hmm.
And the last time was with a person who's a fellow in the actually one of only two fellows in Central Ohio,
Yep.
like you. And to his credit, he introduced the pain science to me
Cool.
too. It was more of an educational type thing. Well, and it started getting me thinking about it. And I give him a lot of credit for that.
Yep. Cool.
But in addition, all the pretty much the regular core strengthening exercises.
Yep. Okay, fair. So he kind of introduced this concept of sort of the mind and the role of psychology on pain, right? But kind of then also kept with that which wasn't working. Is that fair to say?
Yeah,
Yeah,
yeah.
yeah. Okay, cool. Cool, cool. All right. And yeah, I think one thing that I want to touch on here, right? So you went to PT, you saw some really smart people, right? You saw, I don't know, the top PT or one of the top two, right, in Ohio there. And then you came to a virtual online program. And so it's like, WTH, man, how could this possibly work? Right? That Charlie can't touch me, Charlie can't feel me, right? Charlie, heck, I don't even know if Charlie saw you a lot, Jim, truthfully. I mean, we talked, right? But I don't think I actually connected with you a ton via
Yeah,
via the internet.
I thought at the beginning that, well, at least I'm gonna, they'll do all this stuff and then and then I learned that, you're not in a position to physically see patients anymore. And I'm thinking, well, that's kind of weird, but it it put me off a little bit, but then I thought, well, I'll just keep chugging along. And it turns out it really wasn't necessary. The support you get through the community is
Very good.
remarkable and very helpful. And there's someone that kind of reaches out and you go back and forth with them and you can post questions and you can see what other people are doing. And it's really that kind of makes up a lot for the actually complete, and actually it just makes a lot of more sense the way you have it structured.
Yep.
And I had I had my call with you, I think 8 weeks in maybe.
Yep.
But you can always get a sign on for one of the two coaching calls and have your individual question individually answered by
Yep.
you.
Whenever you need. Yep.
And I had to do that, I think, twice.
Yep.
But I was able to just go through teach myself and kind of go through the process.
Yep.
But there was no lack of support. And actually, if you think about it, the way you guys have it structured makes a lot more sense than, all right, well, my next appointment is in 4 weeks. Can you do 9:15?
Yep.
And then what are you going to do for the 4 weeks? You wait that you can talk to the person.
Yep.
You don't have that. You could talk to you as many as twice a week in a heartbeat.
Yep. Yeah, totally. Okay, fair. So I think that's useful, right? Because yeah, I vividly remember the conversation with you, right? You chatted with me and then you chatted with a member of my team as well, right? And I think it was you were a bit skeptical in the beginning, is that correct?
A little bit, yeah.
Yeah,
Well, I'm an attorney, and
Yep.
for 40 years I tried cases, so I'm
Yep.
not the most accepting person in the world. I've seen a lot of, nasty stuff, but
Yeah, totally.
but hey, once you get into it, it's like, yeah, this makes sense. All
Yeah.
right, next lesson. Wow, this makes sense. Never thought of this. Next lesson. Wow. Oh, yeah. I wish I'd known this before. And it's nice to kind of rely on yourself to kind of go through the process. Yeah, it's just I mean, if you want to kind of self-heal, this is the way to go. And frankly, given the medical system and how it's siloed, this is the only way to go.
Yeah, awesome, man. Well, I appreciate you sharing there. And so, to be clear, right, in the beginning, yeah, you were skeptical in the sense of, yeah, Charlie doesn't see people in person. Right? I think he even maybe considered coming to see me or something like that at some point, right? He's this online virtual, has this online virtual process and teaches people how to treat themselves. But a lot of people I chat with, Jim, are like, man, I don't understand how it's possible that you could not put your hands on me, right? How I've seen all these people who are very smart. I mean, you're not talking about nobodies. I mean, Cleveland Clinic, Ohio State University, fellows within PT. I mean, they're higher trained than I am, right? And I'm like the top 1% as far as the training goes, and they're like the top 0.5%, the fellows, if you will. And so that level of training is not very common. And yet something was sort of missed there. And so what would you say to anybody who might be watching and saying, hey, man, I've tried all these things. I've seen all these smart people. I've gone to the Mayo Clinic. I've gone here. I've seen the top docs here or there. I've seen the doc for this professional sports team, right? And they couldn't fix it. How are you going to fix it, especially not being able to put your hands on me? What would you say to someone who's kind of in that boat?
Well, because the ultimate way to get well is to heal yourself. If you went to Charlie, in order for Charlie to have meaningful discussion with or of your individual situation, it would take him 4 hours to go through all this stuff in order to get there.
Yep.
And but he's got all that set up lesson by lesson in advance. So it's like you're talking to him. In fact, he's recorded, and
Yeah.
so why it just doesn't make sense for him to repeat 8 hours worth of stuff in order to find out exactly where you are among all the variables, when you can go through that process yourself and figure out yourself where you are, and then ask him questions along the way.
Mhm.
And so from a standpoint of you, in other words, for you to meaningfully address something, there's so much stuff you need to go through that it would take you 8 or 9 hours or so in order to meaningfully, it's not like, sticking your finger in, oh, well, tell me where it hurts. I mean, that's meaningless. This is the way to go. This is the only way to go.
Yeah. Yeah.
Makes
What,
sense?
yep. Yeah. And so I never put my hands on you, right? So how is it possible I could tell if it was your SI joint or this or that, or if things were rotated or if things were twisted or all the stuff that you've probably been told? How is that possible? Because I have
Well,
yet to develop a technology.
it's irrelevant. I mean, you're trying to take, Charlie, shame on you. You're taking me back into the existing medical paradigm of we can't figure out how to fix you unless we know exactly what's wrong with you.
Yeah. Yeah. Let's talk about that. It's good.
That's not the paradigm. The paradigm is because within 6 or 7 months, the science says that everything that could go wrong that causes your back pain should have healed on its own.
Yes.
So there's a mental focus to it. There's a residual focus. There's still probably movements that are sensitive, but it's instead of, well, we can't do anything until we know the cause. It's okay. It's been going on this long. What movements help or don't help, and then what can you do to retrain your brain to stop sending false danger signals of pain that really isn't there, because the purpose of pain is to tell your brain to tell yourself to restrict your activities and movement. But if it's healed up, they'll still start sending those false signals.
Yep. Yeah. So yeah, so it's not treating the diagnosis, right?
Exactly.
It's treating the symptoms and or the pain experience.
Exactly. It's how do we get past the pain experience? And everybody in the program, is probably their pain had a genesis with some sort of injury, but by the time they get to you, Charlie, it's probably healed.
Yeah. And so I think the takeaway, right, is again, you went down the very traditional route. And while you got some results there, number one, it didn't really follow a process, right? And that's kind of what I try to pride myself on, is trying to improve the process through which people who are dealing with the pain experience, both mind and body, can go through systematically to figure out the most likely kind of source of their symptoms, not diagnosis per se, but what's driving the symptoms, whether it be the way you're moving, the way you're bending, the way you're sleeping, any thoughts, beliefs, fears, worries, concerns, any of those things we take into account. That's kind of where we start, right? And then we hand it over to you, right? And we say, hey, look, you're the one in pain, Jim. And so I could poke you, and I could probably poke you right now on the side of the cheeks, and you could say, ow, right? But what meaning is there, right? And so at the end of the day, you can go down the rabbit hole chasing the diagnosis, or you can learn to treat the pain experience, which is actually a little bit liberating, because it's like, oh, I'm not defined by this thing anymore. Cool, okay? And then, yeah, we hand it over to you. You're the person in pain. And so some people take this the wrong way, but it's like, you can't just expect someone else to fix you, because I don't have control, Jim, over your mind or your body. And whether you knowingly or unknowingly did something to create it, you did create it somehow, right? And so I can give you a process. You can plug into that process, and you can start to move your body and start to understand, right, a little bit more about pain and what's happening. And you're going to kind of put the puzzle pieces together, right? And so I think a lot of people might be watching this who are in pain are like, how can I put the puzzle pieces together? And I think you already said it. It's sort of step by step. But anything else that you would say to someone who's maybe like, man, I just don't know if I could do that. I still feel like I'm not the doctor. I don't know how I could figure this out. Is there anything else you'd kind of share with them?
Well, you can figure it out a lot easier than the doctor can, because it's you.
Yeah.
And just keep, this is the roadmap that you can take down the road on your own and get to the promised land. And nobody can lead you down that. You have to do it on your own. And it takes time, it takes effort, and it takes resolve, but it's not hard. It's just about spending the time and going step by step by step.
Yep. Yeah. And let me ask you this too, right? Short-term stuff, shots, pills, things like that.
That was one of the better things you all suggested at the beginning of the program, was to stop all the stuff.
Yep.
So at the time I started, I was going to a friend's chiropractor every week to get, I don't know, I'm not sure what they were doing. They were poking here and there. And then I was still going to PT. And then I was going to my pain doc to manage my medication. And you suggested just stop all the stuff, so you have a clearer picture of kind of where you are as you go through the process. And it made great sense. So the last step I finished last couple weeks ago. I weaned myself off of my gabapentin that I've been taking for 2 years.
Awesome.
And pyzanidine, which I've been taking for 2 years. And just a little, and my pain gut doc was helpful in kind of telling me how to wean my, so now I'm not taking any medication, except occasionally if I have an ache or pain, I'll take a Tylenol.
Yep. Cool, man. Awesome. And do you feel like you have the long-term tools now, right, in the future, since you've gone through the process?
It's 100%. If you get in the program, you get to use the lessons forever. And I haven't had the need to go back to any, but if I do, I will. And there's a couple other extraneous sources that you are referred to in the program that I may look at too, if I get in a bad position.
Totally, man. Cool. Okay, so if you're watching this, Jim goes from, hey, we want to pin your SI joint, right? We want to do an SI joint fusion on pain meds, gabapentin, things like that, right? Which long-term can be just some nasty things. Research is pretty clear on that at this point. It can help some people, but it definitely, doesn't do very well for a lot of people. Not to mention, I know you didn't want to be addicted to those things, okay? So to a point now where you have not only the relief that you're looking for, but also the tools, knowledge, and understanding you need in the future. And man, I just want to say I'm super proud of you. You were able to avoid a surgery. I always say, hey, naturally, without pills, shots, or surgery, and we've pretty much succeeded mostly in that so far, avoidance of that. And more importantly than anything, man, you have the tools, knowledge, and understanding, and yes, support. You can always come back into the community. We never take away access to any type of support. So you can come back in, ask us any questions if you ever, trip up or need some more support. So cool, man. Any final words? Anybody, again, who's on the fence, who might be watching this saying, I've got some type of pain in the back, butt, or leg. I just don't know what to do about it, but I don't know if Charlie can help. What would you say?
Go for it. It's the best money you'll ever spend.
Cool, man. Awesome. Well, hey, dude, I appreciate you, Jim. Thank you so much. I know there are still big bucks running around there, so maybe we reach out sometime and set something up. But
hey, you and your brother are welcome, dude. So
awesome. Well, thank you so much, Jim. I appreciate it, man. And look, if you need anything, reach out. For anybody else, again, who is watching, who says, okay, I am going to go for it, right? How can you do that? Well, what you can do is you can click a link actually below this video somewhere, or I'll put a little card or something, whatever they call it. And basically what we would do in the first step, and we did this for Jim, is we would review your case. So I would basically have you set up a time to chat with us, and then you would submit what we call a case review. The case review is something I developed, basically a questionnaire, if you will. I've reviewed thousands of these. So after doing this a few times, you get pretty good at identifying, can we help or can we not help? If we don't feel fully confident we can help, we'll just tell you. All right. You still might be skeptical if we tell you can help, but that's okay. And so at the end of the day, if we feel we can't help, well, then we'll just let you know that too. No harm, no foul. We go our separate ways. So click the link below to apply to work with us and to submit details of your case and set up a time to chat, just like Jim did. So thanks so much, Jim. I appreciate it, man. We'll chat soon. Okay.
hey, take care.
Thanks,
Bye.
buddy.